Good. Well, good morning, everyone. Welcome. Welcome through the screen, through our virtual screen, to our 11th Sparkasm, virtually again. I'm hoping that everyone can hear me. Maybe someone can give me a thumbs up in the chat if it's working. And we'll get on with what hopefully will be an interesting and exciting day. I'm just going to move back up to this. There we are. So this 11th Sparkasm, we're aiming to showcase our research that's going on in Scotland and quality improvement work with a view to developing our Scottish Pain Research Network to try and improve patient care. And we've got a few housekeeping things first. Mobiles switched off onto silent. No planned fire alarms, I hope. We don't need to wear masks. That's one of the few advantages of maybe not having to meet face to face. Unless you're speaking, just please keep your camera off and your microphone muted during the sessions. And the chat function on the right-hand side of your screen, you can make comments and also submit questions. And this is always, when it's a face-to-face meeting, it's always very interactive. So we'll try and keep that way as much as possible, despite our virtual meeting. And it's always good to get feedback. We had feedback from our December meeting, and we've tried to act on that and try and improve things. So you'll get sent a link to an evaluation form after the meeting, and please try and fill that in if you have time. But it would be very much appreciated so that we can try and improve things for next time. So for those of you who have not been to Sparkasm before, Spark this is now our 11th year running, and I think a really exciting mixture, very open organisation, bringing together a range of people from different backgrounds, people with lived experience, researchers, both clinical and non-clinical, ranging from the preclinical through to data scientists, clinical academics and third sector organisations. I very much founded with the aims that in clinical practice we should be managing chronic pain informed by the best available research, and that our chronic pain research is very relevant to clinical practice, and what we're doing is informed by that in terms of our research priorities. Although we're a Scottish meeting, we're very keen, and indeed we aim to develop links far beyond Scotland to try and break down silos in terms of research and work together to improve patient care, despite the impact that recent or not so recent events have had with COVID on our ability to work and interact with each other. So very quickly, before we move on to the meat of the meeting, for those of you who have not attended before, this is our second virtual annual scientific meeting. Please forgive any IT glitches. Hopefully we won't have too many. And I think we've got a really exciting programme. I'm delighted to welcome, to speak to shortly, is Nicola Rind, is our new National Lead Clinician, who's taken over from Blair Smith. And she's going to give us an update as to what's happening nationally. And also later in the programme from our National Primary Care Lead, Kieran Dunwoody, is going to give us an update on what's going on in primary care in terms of chronic pain and developments there. And I'm really pleased that we've got two internationally renowned keynote speakers. I'm very excited and looking forward to their talks. David Walsh is this morning, and Claudia Summer this afternoon. We've also introduced a new public and patient involvement session, which is going to be run by our patient partners on the steering committee, and I think that will be an interesting innovation, and we're keen to develop that aspect of Spark further. And then there are selected oral research presentations. We always aim to make this a kind of a good forum to present in for early career researchers through to more senior researchers, and as interactive as possible. So there's always time for questions at the end. Because we're working remotely, if you can submit your questions through chat during the presentation, if you can, that will try and help us keep us to time. And then this afternoon, we've got the data blitz and the poster session, which is always popular. And we've increased the time to allow you to go and view the posters individually and have some one-to-one chats with the poster presenters, interspersed with coffee and lunch, which I'm afraid is bring your own. We'll try and improve on that next year. And the networking function is interesting. It's a little bit like speed dating, not that we've ever done speed dating, but you get 3 minutes with a random person just for a chat. And it worked really well actually in the December meeting. That's over on the left-hand side of your screen during the networking sessions. And we'll be awarding prizes. We've got an oral and poster presentations. The steering committee will be judging the oral presentations, and you, the audience, can vote on your favourite posters, and that will be in the set. You can vote on the right-hand side of the screen under polls. And I will announce the successful recipients in the closing session. So I'm not going to talk anymore. I'd like to introduce Nicola Rind, who has very kindly agreed to give us an update on events nationally and what has been a really challenging time period over the last 18 months for chronic pain services. And she, took on the difficult role at that time during COVID, taking over from our long-standing previous national clinician, Blair Smith. So, Nicola, I'm delighted to welcome you today. And very much looking forward to hearing what you have to say.
Thank you, Lesley, for your introduction, and good morning, everyone. Just bear with me a moment as I get my slides up. So hopefully you can all see that. It's a great pleasure to be speaking at today's meeting, and I hope to give a national update on chronic pain developments. So, as Lesley said, I'm Nicola Rind. I'm a physiotherapist working in the pain management service in NHS Grampian, and I've recently taken on the role of National Clinical Lead for Chronic Pain. So, as Lesley said, there's no denying it's been a challenging time for services over the last 18 months or so. And although COVID has impacted clinical activity, pain services from health boards across Scotland have been reporting innovative service improvements and developments, and these have been established to address growing waiting lists and to continue to provide access to services. So our pain management programmes have gone virtual, along with early information sessions, and digital appointments are being utilised across the country. Enhanced vetting with active clinical referral triage and patient-initiated return are being adopted as part of remobilisation, and this has been leading to an improvement in patient pathways. So I think it's really important to recognise this good work that's been going on despite the challenges that we've faced. And I've been visiting health boards across Scotland to understand what's working well and what challenges there are as services begin to remobilise. The Scottish Government has highlighted chronic pain management as a priority service within the remobilisation strategy. So where are we now? We are familiar with the statistics around chronic pain, although we could be better understanding their impact. And we know that despite considerable efforts across the last decade from both local services and with national policy, that there still remains great variation in access and provision of support to treat and manage chronic pain across Scotland. And the National Lead Post was established in 2009, and this was to take forward the priority actions of the GRIPS report. And this led to the development of the service model that you see here. So essentially, improvements in chronic pain services have been ongoing since 2010. And I'm sure you're all aware we had the publication of the SIGN guidelines in 2013. SIG funding came along the following year. And then the National Residential Programme hosted by Glasgow followed in 2015. The National Advisory Committee for Chronic Pain was established shortly after. And then following that, guidelines for children were endorsed and the Quality Prescribing Strategy was published. The core minimum data set was then funded and developed. Following this, in 2018-19, the Scottish Access Collaborative then hosted a series of design workshops. And the focus of this, with clinical and community stakeholders, was to develop recommendations for chronic pain service improvements. And these were to be taken forward by the Modernising Patient Pathways Programme, or MPPP. In 2020, chronic pain commitments were included in the programme for government. But we continue to hear from our stakeholders that we need a unifying vision across Scotland to ensure a shared understanding amongst both service users and service providers. And we continue to work on gaining consensus around pathways and treatment. A new framework for chronic pain service delivery has been scoped and designed, and the aim of which is to provide this once for Scotland approach. So the Scottish Access Collaborative Workshops and Stakeholder Survey identified key recommendations for chronic pain service improvement. And MPPP are supporting and funding projects all across Scotland that are focused on these key recommendations and the further evolution of the chronic pain service model. And a key area for this is the primary-secondary care interface, coined Level 2.5. And the main focus of the MPPP projects has been centred around effective prescribing, education and training, supportive self-management and workforce development. And I know you're going to be hearing more about these projects later this morning from Kieran Dunwoody, our GP advisor with MPPP. So the framework focuses on the needs of people with chronic pain, and it's intended to improve support for chronic pain by a whole system approach. And it builds on the principles and priorities outlined in the Recovery Framework for Pain Management Services, and it also recognises the priorities identified within the Scottish Access Collaborative Report, and the priorities highlighted by the Chronic Pain Lived Experience Group. And the National Advisory Committee that I mentioned earlier has been shaping the draft aim and priorities for the framework. And this committee is made up of representatives from across the NHS, health and social care partnerships, third sector, lived experience, academia and health professionals working in pain management. We also have Scottish networks for some of the professional groups working within pain services. So we have an AHP network, a nurses network, a psychology network. A pharmacy network has recently been established, and the first Medic network meeting is planned for later this year. And I think these networks are invaluable for professionals to provide support, share practice, develop consensus around service provision. And we've been working to gain representation from each network at a national level, allowing each professional group a voice to shape and inform policy. So under each of the key drivers that you see here, we'll set commitments to support the key aim. So as key drivers, we have development of pathways, including digital pathways, evidence-based and timely treatment, building a sustainable workforce, and this includes education and training, and the collection of data on the impact of chronic pain. And this allows us to shape service and inform service provision. And you can see the COVID-19 response and research and QI are run alongside these central priorities. So working groups have been established already around workforce, education and training, and then in the development of a remote healthcare pathway with Highland Health Board as the test centre. And the framework is due to go out for public consultation, and we've been engaging with health boards and the professional networks to better understand some of the challenges and the opportunities around the framework, and to build consensus on management and service vision. So how does the framework align with research priorities in Scotland? How we build on the excellent work that's already been done, aligning research with chronic pain priorities in areas such as bringing research into clinical practice, implementation of evidence-based practice, understanding the barriers to this, and joining the academic and clinical communities is a central factor. And to understand any gaps that may limit the framework implementation and how we can complement what's already been done in this regard is key, as research is crucial in supporting the success of the framework. And I think where we are now is built upon the work that's been done over the last decade. And although we do have some way to go, the new framework and the commitment from the Scottish Government around pain services is moving us towards a sustainable change to chronic pain service provision that we can all be part of. Thank you for listening.
Great, excellent. Thank you very much, Nicola, for a really comprehensive overview. And it's heartening that despite COVID, there are still obviously some really good developments going on within Scotland. In the interest of time, I think we won't take questions because I think that could take quite a long time. I'm sure lots of people have got questions, but I know you've got to leave, but hopefully you'll be able to join some of the networking sessions and meet with us individually. But thank you very much.
Thanks, Lesley.
I'll give you a little, I should have had some taped applause, but there we are.